Tea tree oil is not extracted from the plant commonly associated with tea as a beverage. So it is not related to tea oil, which is extracted from the seed of the tea plant Camellia sinensis. Instead, tea tree oil is obtained from the leaves of any species of Melaleuca that conforms to the ISO standard. Melaleuca alternifolia, commonly known as tea tree, occurs naturally in some areas of Australia, on the north coast of New South Wales where it is restricted to the narrow plain between the coast and the dividing range. The tree occurs mainly in moist areas and swamps. The Australian tea tree oil industry has flourished in last 50 years. The volatile oil constituents of tea tree make it a valuable and commercially important medicinal and aromatic plant. Beside Melaleuca alternifolia, two other species of this genus, Melaleuca linearifolia and Melaleuca decidiflora, are also exploited commercially but on a small scale. Melaleuca alternifolia is indigenous to Australia, where it is found growing from Queensland to north East New South Wales at up to 300 meters altitude, on the soil with pH ranging from 4.5 to 7. Other varieties of tea tree oil have been cultivated somewhere else, but Melaleuca alternifolia is not produced outside Australia. Tree mainly occurs in moist areas and swamps where it forms fairly dense stands that often contain relatively few other species. This species mostly prefer well-drained soil and suitable for sandy, loamy and clay soils. It cannot grow in the shade. This species is frost-sensitive and in warmer months its leaves possess highest oil content. The European inventory contains 3 Melaleuca-type ingredients: Melaleuca alternifolia oil, Melaleuca cajaputi extract, Melaleuca leucodendron extract. Tea tree oil is the essential oil obtained by steam distillation of the leaves and small twigs of Melaleuca alternifolia, Melaleuca linearifolia and Melaleuca decidiflora as well as other species of Melaleuca. However, tea tree oil is commercially produced from Melaleuca alternifolia. Tea tree oil is composed of terpene hydrocarbons including monoterpenes, sesquiterpenes, and their associated alcohols. Terpenes are volatile, aromatic hydrocarbons and considered as polymers of isoprene with formula C5H8. Relative density of tea tree oil is 0.885 to 0.906. It is only sparingly soluble in water and is miscible with nonpolar solvents. When tea tree oil is exposed to light, moisture and high temperatures, its composition gets changed. The levels of alpha-terpenin, gamma-terpenin and terpenoline decrease whereas the level of p-cymon increases up to tenfold. Composition also changes in the presence of atmospheric oxygen. Process of oxidation occurs which leads to the formation of peroxides such as endoperoxides, ascaridole, and epoxides. Tea tree oil shows strong antimicrobial activity. It inhibited the growth in vitro of Escherichia coli, vancomycin-resistant Enterococcus faecium, Staphylococcus aureus, methicillin-resistant Staphylococcus aureus, and a variety of Streptomyces species. It also inhibited the growth in vitro of Trichophyton mentagrophytes, Trichophyton rubrum, Microsporum canis, Malassezia furfur, Candida albicans, Cryptococcus neoformans, Pterospermum ovale and Trichosporin cutaneum. The chemical constituents of the tea tree oil such as linalool, terpene N4OL, a terpenol, a terpenin, terpenoline and cineol, inhibited the growth of various microorganisms, including Candida albicans, Escherichia coli and Staphylococcus aureus. Tea tree oil generally boosts health due to its balsamic properties. It increases the absorption of nutrients and also provide protection from certain diseases. Due to its cicatrisant property, tea tree oil quickly heals wounds and also protects them from infections. It provides relief from cough and cold, congestion, bronchitis and other troubles associated with colds by rubbing tea tree oil on the chest. Tea tree oil is an efficient insect killer. It does not allow parasites and other insects like mosquitoes, fleas, lice, or flies to come near someone who has rubbed some of this oil on their body. Tea tree oil is an excellent antiseptic, so it can be a wise preventative choice in case of wounds. It can be applied on the wounds, boils, sores, cuts, skin eruptions, insect bites and stings, to protect them from infections. Tea tree oil has stimulating effect on hormone secretions, blood circulation, and most importantly, on the immune system. It acts as a protective shield against many different types of infections. Tea tree essential oil promotes sweating and the removal of toxins like uric acid. Furthermore, it helps to remove excess water and salts from the body, and clean the pores. It also prevents the occurrence of acne. According to a study, 40% emulsified solution of tea tree and 13% isopropyl alcohol is effective in the treatment of 130 women with cervicitis or vaginitis due to Trichomonas vaginalis or Candida albicans. Intravaginal application of tampons saturated with a 20% emulsified solution healed cervicitis caused by Trichomonas vaginalis after 4 weekly treatments. In patients with vaginitis due to Trichomonas vaginalis, intravaginal application of a 1% emulsified solution using a saturated tampon, as well as vaginal douching, resulted in clinical cures and restoration of the cervix. According to another study without controls, 28 women suffering with vaginitis due to Candida albicans were treated with vaginal pessaries containing 0.2 grams essential oil every night for 90 days. After 30 days of treatment, 21 were free of Candida albicans and 24 patients were free of symptoms such as leukorrhea and burning sensation. Tea tree oil has significant anti-acne properties. By the topical application of a gel containing either 5% essential oil or 5% benzoyl peroxide in the treatment of mild to moderate acne in 119 patients. The results demonstrated that both preparations significantly reduced the number of inflamed and non-inflamed lesions after 3 months of daily treatment. Although the onset of action of the gel containing the essential oil was slower than that of the gel containing benzoyl peroxide, patients treated with the oil-containing gel reported fewer side effects than those treated with the benzoyl peroxide-containing gel. So essential oil was more effective as compared to benzoyl peroxide. It cures different viral infections like the common cold, influenza, mumps, measles, and pox. Tea tree oil is very effective against dandruff. According to a study conducted by a single-blind, parallel group, the shampoo containing tea tree oil, 5%, was proved effective in 126 patients with mild to moderate dandruff over 4 weeks. Various studies indicate that tea tree oil is effective in removing MRSA on the skin. A formulation of 5% tea tree oil body wash and 4% tea tree oil nasal ointment was found to be better than the standard 2% mupirocin nasal ointment. Topical application of tea tree oil is effective against head lice. Compounds responsible for this activity include phenols, phenolic ethers, ketones and oxides. Tea tree oil is also found to be effective against both head lice and dust mites. Wart eradication. A study reported that daily topical application of tea tree oil for 12 days successfully eradicated warts on the hand of a pediatric patient. Tree oil is used in various forms, such as gels, creams, ointments, oral rinses, soaps, shampoos and paints. Different concentrations of tea tree oil are used to treat different diseases such as bactericidal. Concentrations are generally 0.25%. For acne, 5% essential oil in cream or gel. For onychomycosis, 100% essential oil applied twice a day. Topical use is safe and that adverse events are minor, self-limiting, and infrequent. Tea tree oil can cause both irritant and allergic reactions. Since irritant reactions may frequently be avoided through the use of lower concentrations of the irritant, this bolsters the case for discolor aging, the use of neat oil, and promoting the use of well-formulated products. Allergic reactions have been reported. A range of components have been suggested as responsible. The most definitive work indicates that they are caused mainly by oxidation products that occur in aged or improperly stored oil. There is little scientific support for the notion that 1,8 cineol is the major irritant in tea tree oil. Tea tree oil can be toxic if ingested, as evidenced by studies with animals and from cases of human poisoning. Incidences of oral poisoning in children and adults have been reported. In all cases, patients responded to supportive care and recovered without apparent sequelae. No human deaths due to tea tree oil have been reported in the literature. Allergic contact dermatitis after external application and ingestion of tea tree oil has been reported. No adverse reactions were reported in 2 patch tests using preparations containing up to 5% essential oil. Accidental ingestion of 10 ml essential oil caused confusion, disorientation and loss of coordination in a 23-month-old child. Ingestion of 2.5 ml essential oil by a 60-year-old man resulted in a severe rash and a general feeling of malaise. Induction of a comatose state lasting 12 hours, followed by 36 hours of a semi-conscious state accompanied by hallucinations, was reported in one patient after ingestion of approximately half a cup, 120 milliliters, of the essential oil. Abdominal pain and diarrhea lasting up to 6 weeks were also reported. Number of medicinal as well as other uses throws light on the importance of tea tree oil, but still there is need of comprehensive research for exploring its all other beneficial aspects including its nutritional properties.